your.reg.nextdoor. I'm a doctor in Australia. Today we are going through some medical abbreviations. I've named this series M.A.T.E. We use so many medical abbreviations day to day in clinical practice, it's sometimes a bit ridiculous, but it does help us make documentation more efficient. I have so far compiled a list of more than 200 abbreviations, and I hope to break them up into categories. Today we're covering common abbreviations that you will see on patients' progress notes. The video is set up in a quiz format where I get you to guess what the abbreviations stand for, followed by the full word or words and a brief explanation. Let's go! Let's start with this one. Can you guess what this stands for? Did you get it right? PT stands for patient. RV. RV stands for review. Review is synonymous to assess. You review patients when you check up on how they are doing. HX. HX stands for history. History is basically the story, the patient's story about their medical condition or symptom. PC. PC stands for presenting complaint. Presenting complaint is the main problem that the patient is seeing you about. For example, presenting complaint may be chest pain or itchy skin. HPC. HPC stands for History of Presenting Complaint. History of Presenting Complaint is the story and details surrounding the patient's presenting complaint. If the patient's presenting complaint is chest pain, you would ask all the relevant questions about their chest pain. PHEM-HX. PMHX stands for Past Medical History. Past medical history is all about the patient's past medical history. For example, if the patient's presenting complaint is chest pain, you would want to know if the patient has had a previous heart attack and what happened to treat their heart attack. SHX. SHX stands for Social History. Social history is about all the non-medical things about the patient that is important for us to know to best care for the patient. Common questions I ask my patients are regarding their living circumstances, where they live, who they live with, whether they use a mobility aid, if they have any paid services that come into their homes to assist with shopping, cleaning, cooking, and personal hygiene, whether they smoke cigarettes, drink alcohol, or take recreational drugs. OE. OE stands for On Examination. After OE, I document my examination findings, which includes the patient's vital sign and the physical examination findings, like what their lungs sounded like and how their wounds appear to you. TX. TX stands for treatment. Treatment, as the name suggests, is a treatment that you provide to a patient. If I give my patients pain relief and intravenous fluids, I would document them under treatment. MX. MX stands for management. This is similar to treatment. CX. CX stands for complicated. We use this when we want to mention if their condition or treatment was complicated by something. Check out the example on the slide. PDX. PDX stands for Provisional Diagnosis. After a doctor takes a history, does an examination, and performs some investigations, the doctor will have some idea about what the patient's main problem or diagnosis is. Provisional diagnosis is their first impression on what the diagnosis might be. DDX. DDX stands for differential diagnosis. When doctors think the patient's problem can be due to multiple different diagnoses, they document a differential diagnosis stating all the different possibilities for the patient's problem. RxN. RxN stands for reaction. RF. RF stands for risk factor. Risk factors are patients' age, sex, or condition that may predispose them from having a disease or medical condition. ATSP. ATSP stands for Asked to See Patient. This is usually used by doctors and seen at the top of their documentation when they are asked to see a patient by a nurse regarding a particular problem. For example, the nurse may ask the doctor to review a patient for a low blood pressure. ATRP. ATRP stands for Asked to Review Patient. This is the same as ATSP, C/O. C/O stands for complaining of. This is used when patients are reporting certain symptoms or used in other ways when patients literally complain about something. It may appear to have a negative connotation, but it simply means patients are reporting or stating something they are concerned or worried about. However, it can sometimes be used in a literal way. SOOB. SOOB stands for sit out of bed. This is literal. When doctors or physiotherapists want a patient to get out and sit out of bed, they would document SOOB in part of their plan. This is important activity for otherwise bedbound patients. It also helps patients get into a routine and helps to limit daytime sleeping. TOV. TOV stands for trala void. Trala void is done for patients who have indwelling catheters, which is a tubing that goes through a patient's urethra and sits in the bladder and allows urine to drain freely into a collecting bag. There are many indications for indwelling catheters. Doctors will instruct that the indwelling catheters are removed, at which point the patient goes through a trala void process, which is simply seeing whether patients will be able to empty their bladder on their own without the catheter. ET. ET stands for exercise tolerance. Exercise tolerance is another way to say how fit the patient is. It helps healthcare workers to understand what level of activities the patient are capable of when they are well. It is a good way to gauge how the patient's current illness is impacting their level of activity, a measure of how unwell they are. NBM. NBM stands for nil by mouth. Nil means nothing. Patients are made nil by mouth for several reasons. For example, they may need to fast before a surgery, or stroke patients may be made nil by mouth if their swallowing is impaired. CFD. CFD stands for Clear Fluid Diet. You may see this abbreviation on the surgical or gastrointestinal wards. It is a special diet patients are put on. Examples of clear fluid items are water, tea, and apple juice. FFD. FFD stands for Free Fluid Diet. This is another abbreviation seen often on surgical patients. Example of free fluid items are milk and custards. OT. OT stands for Operating Theater. NH. NH stands for Nursing Home. Hash symbol. Hash symbol stands for fracture, as in fracture of bones. CPR. CPR stands for cardiopulmonary resuscitation. Cardiopulmonary resuscitation is a procedure where you provide chest compressions when a heart stops beating in efforts to restore blood circulation. DNR. DNR stands for Do Not Resuscitate. A DNR order is placed on patients who have either expressed that they do not want to have CPR performed when their heart stops or deemed to not benefit from CPR due to their underlying conditions. ACP. ACP stands for Advanced Care Plan or Planning. Advanced Care Plan is a broad term that encapsulates the process and documentation of what the patient wants in their future healthcare when they are no longer able to express their wishes verbally. It helps family and healthcare professionals make decisions about how to provide healthcare to that individual when he or she loses their capacity to make decisions. ACD. ACD stands for Advanced Care Directive. Advanced Care Directive is similar to Advanced Care Planning in the sense that it outlines or wishes about future health care. The difference is that a directive is a legally binding document that provides instructions about the patient's future medical treatment. Different states have different requirements surrounding the Advanced Care Planning and formulation of Advanced Care Directive. Check out advancedcareplanning.org.au for more information. ADL. ADL stands for Activity of Daily Living. Activities of daily living are activities like shopping, cooking, cleaning, and activities related to personal hygiene. It is a way healthcare professionals can understand how a patient's medical condition affects his or her function at home. DAMA. DAMA stands for Discharge Against Medical Advice. Discharge against medical advice is when a patient who has a capacity to make decisions about his or her healthcare leaves the medical facility and refuses treatment against the doctor's advice. DNAC or DNAC. DNAC stands for Did Not Attend Call. You would likely see this used in the emergency department. Sometimes, patients that have registered themselves to be seen by a doctor decide to leave the emergency department for whatever reason before they are formally discharged and are unable to be located in the facility. In this instance, we say the patient has DNAC'd. AWS. AWS stands for Alcohol Withdrawal Scale. Alcohol withdrawal scale is based on a series of criteria to assess whether the patient is withdrawing from alcohol. Based on the score, the patient is given treatment to help with their withdrawal. EtOH. EtOH stands for alcohol. Need I say more? That's it for me today. There are tons more abbreviations I will be covering in the future. If you're not from Australia, let me know in the comments below the different abbreviations you use that is different from what I covered today. Please like and subscribe. See you next time.